The Mental Health Situational Analysis report was completed in April of 2019, or 3 health ministers ago. It was commissioned by the GHA when Neil Costa was minister, but the findings were not made public during his tenure, nor that of his successor, Paul Balbang. Its publication now, under Minister Samantha Sacramento, has been welcomed by the Mental Welfare Society and others as a positive step, albeit one that requires further steps in order to achieve real change. The audit deals with 4 areas of mental health provision. The first, policy and plans, recommends that a national policy and plan should be developed. It also highlights a rather stark figure of 256 attendances at A&E for attempted suicides across a 2.5-year period. This translates to an average of around 2 attendances a week, although it is unclear how many individuals were involved. The report also finds a lack of information on the budget breakdown for mental health. A 2017 report that 6% of the GHA budget was spent on mental health suggests over £7 million being available annually, but no formal budget or itemisation could be identified. This section recommends that a comprehensive mental health needs assessment be undertaken towards bridging the gap between the systems that should be in place and what service users experience in reality. Section 2 covers mental health services and finds a lack of clarity as to who is responsible for what, while highlighting the lack of working data and recommending better systems to compile information on diagnosis, referrals and treatment. In the 4 years leading to last April, over 18,000 visits to the primary care centre were coded as mental health related, around 6% of total visits, well under the 40% average found by mental health charity Mind in the UK. In 2018, 759 referrals were made from primary care to mental health services, although information is lacking on how long these took to materialise, a key issue raised by service users to GBC. The document suggests more clear referral pathways and the establishment of a central triage point. Also mentioned is the discharge process at Ocean Views, with patients reporting dissatisfaction with a lack of support and follow-up. Section 3, on the community, observes that campaigns to destigmatise mental issues are having effect. It is noted there is a strong NGO sector, clear progress in integrating mental health provision in school, and a strong awareness of related issues and protocols in most non-health services. Section 4, on information systems, states that there is inadequate data available on the requirements of the population, with the service therefore becoming supply rather than needs-led. The recommendation, again, is to facilitate the collection of information through investment in hardware and software to maintain a database. The report concludes that there are many positive aspects to the mental health services in Gibraltar and many of the components of a thriving system. The challenge, it states, is to coordinate and integrate these through an overarching strategy so as to ensure a user-friendly and effective mental health service for all those who need it.